Welcome back to the Oral Health Podcast, where we are going to be discussing all things related to toothache. So, this must be one of the most common ailments that we could really speak about, especially because we tend to focus on the mouth and mouth health. Everyone at some point or other will have experienced toothache at some point in their lives. Um, I know I get really sensitive teeth, so that's a constant struggle for me. Don't like to go on about it, but
You
it's
may have
something that,
mentioned it once or twice.
yeah, just a few. But it's a horrible feeling and it's very unique. It's not really like any other kind of aches and pains, wouldn't you say so?
I would say so. And obviously, this time of year when we've got sort of a nasty chill in the air, it can be debilitating for some people because you go out in the cold air and you breathe in and, you get that jangly, spiky feeling, don't you? So, often you need to wear a scarf around your mouth or something to stop that air from going in quite so cold. But yeah, I mean, it is a unique feeling, but it's not always something that you necessarily have to worry unduly about because with sensitivity, as soon as the stimuli, i.e., the coldness, goes away, the nerve calms down again, the pain goes away. So it is intermittent and it's caused by something. So we know the cause of it, so we can avoid it. So I mean, for example, if you've ever used like a water pick or a water flosser and you haven't like slightly warmed the water up a little bit, you forget sometimes and just do it from the tap. And boy, do you know when you can find that bit when you're flossing around that just makes you jump that little bit, makes your toes curl.
Absolutely. It's a horrible feeling. But I do actually quite like a water flosser. It's good for cleaning all the bits and recommend them. But yeah, room temperature water, goodness me, that's the only way forwards.
That's indeed.
There's more than just sensitivity that can cause things like toothache, though, isn't there?
There is, yeah. I mean, often dentists will ask you what kind of pain it is, how, what sets it off, and those kind of things. And that is part of diagnosing the pains. So there are a lot of things like sensitivity. We would say put the scarf around your mouth, use a desensitizing toothpaste, use it for a couple of weeks, brush your teeth with it as normal. If you've got an extra sensitive bit, get it on your finger and just rub it in, leave it in on overnight. It has a pretty good uptake doing it like that. And within a couple of weeks, that pain should have subsided. If it doesn't, seek advice from your dentist. Let them have a look. Because if the recession enough to be permanently sensitive, it might need just a little bit of filler material put in there. But there are other types of pain. For example, a sharp pain when you're biting on something, but it doesn't hurt any other time. That could indicate that there is a loose filling or maybe a crack in the tooth. So normally we would say that type of pain, if it doesn't go away, to get to see your dentist just to have that tooth checked out. Now, the teeth are naughty little blighters sometimes because you get referred pain too. So you could absolutely swear that the toothache is on the bottom jaw. And when your dentist looks at it, he'll say, no, it's the top tooth because you can get referred pain. So um, often it's a kind of like a mystery tour trying to find out what's wrong with something. A crack in a tooth is quite difficult to diagnose. They don't show up on x-rays unless you absolutely get it spot on where the crack is. You're not going to see it. You can use a dye, and the dye will show up the crack in the tooth. But often what dentists may do is remove the filling, and often the crack will show itself. So the piece of tooth might come away, or they might be able to see it better if they remove the tooth. Sorry, remove the filling, not the tooth. Um, so there's lots of things they can do. They could take out the filling, put a sedative dressing in there for a couple of weeks, see if that will calm the nerve of the tooth down. Um, so again, it doesn't mean necessarily that it's anything that can't be treated. Um, so that we've got a kind of range, haven't we, there of tooth pain. If you have a tooth pain that is keeping you awake at night, it's not taken away by painkillers, and it's very painful, a throbbing sensation. It's possible that you have an infection or an abscess on the root of the tooth. So again, you need to see a dentist for that. You need that diagnosed. So they will take an x-ray of the tooth. Often there is a dark shadow around the root of the tooth so they can see the infection. They will sometimes tap the tooth because if the tooth is dead, which the nerves die, but what causes an abscess is the nerve inside of the tooth dies and it causes this infection. So essentially the tooth is a dead tooth. So it sounds slightly different when you tap it. It sounds a little bit duller. Another way you can see if the tooth has still got a live nerve in it is with like a detector. So you put it on the tooth and you send a little pulse through the tooth. And if you can feel that, the tooth is still alive. If it's not, it's dead as a dodo. So then you will need root canal treatment to save the tooth. So we go from one extreme right the way through, really, with toothache. Another one that jumps to mind is waking up in the morning and your teeth are aching. That's probably because you've been grinding your teeth at night. Way of finding of diagnosing that also is to put your finger in just forward of your ear where you can feel the top of the temporomandibular joint, so your jaw joint, and just gently move your jaw up and down. And if there's tenderness there, up a little bit higher. We're doing
Karen's
this.
just showing me how to
Okay.
do this live.
So
Like, yeah.
no, come in a little bit nearer your ear, nearer your ear. That's it. So
Oh,
where you,
okay.
yeah,
Yeah.
and if you move your jaw, you can actually feel the joint going. Can
Oh,
you?
yeah. Yeah, you
Yeah.
can.
So if that's painful, you can stop doing it now. She's going to be obsessed. Mm.
Sat in meetings rubbing the
Yeah,
side of
you're
my
going
face.
to, yeah,
No, that's really strange. You can feel it.
yeah. So tenderness there will mean that you've probably been grinding your teeth. Sort of tenderness in the cheekbones, that can all get headaches, that kind of thing. Probably the best one is a partner telling you you're making an awful noise during the night because it's like nails down a blackboard grinding
There is
teeth,
nothing
really.
like the sound of grinding teeth. It
Mm.
is a very unique. Yeah, it's worse than nails on a chalkboard, I think. It's
Yeah.
I'll try and find a sound and I'll put it in here if I can.
Oh no, you're making me feel shivery. It's horrible. But you know, a lot of the things, I've probably given you the worst case scenarios here,
Hmm.
but there are a lot of things that can be done that just to put your mind at rest. So obviously sensitivity is really, really common. I think most people will have, as you said before, most people will have experienced it at some point in their lives, and it tends to come and go. And the desensitizing toothpaste these days are really good, so you could often find that that works. But what you need to do is, you find it works, keep using it, because as soon as you stop using it, the effect will go away.
Yeah.
So um, basically, if you've got anything that's really painful, or you've got any swelling, or it's keeping you awake at night, you're unable to eat, those are more serious things that need to be treated by a dentist. You are going to need treatment to that tooth. So
Hmm.
um, a lot of people do think that the scenario is going to be much worse than they expect it to be. And they're going to need to have the tooth removed. And that will always be the very last resort. There is a lot of things that can be carried out first before that happens.
Hmm.
So, um, so what do you do if you've got severe toothache and you haven't got a dentist? If you haven't got a regular dentist, then you'll need to call 111 and they will try and fix you up with an emergency appointment. Your dentist, if you explain the symptoms, the receptionist will book you in with
Hmm.
somebody as soon as they can. Generally, a course of antibiotics will get on top of the infection. So normally for the first sort of 24 hours, you're going to be in pain. So you need to take your painkillers, keep on top of that pain, and prop yourself up slightly when you're in bed because it tends to throb slightly less if your head's up.
Oh,
So
okay. So like propped up with a pillow almost.
I mean, you don't need to be sitting up, but just make your head higher than your heart,
Okay.
and that tends to make the throbbing less. I'm not going to say it's going to take the toothache away completely, but it's just going to ease it very slightly. But the antibiotics should start kicking in after about 24 hours. So sometimes the dentist will say, take a bigger dose on the first day just to try and get it into your system a little bit, depending on the circumstance. But
Hmm.
that will need further treatment.
Now, what do you think about like lotions and potions and home remedies that people will say are, the best thing for toothache, best thing for this, best thing for that? The one that I think I've heard the most, that is advice given to me, has been clove oil, using clove oil for a toothache.
Clove
What
oil
Karen's making a
is,
face just so because
yeah, I'm making a
I think
face.
I've unearthed something in her talking about clove oil.
Yeah, it will burn. It's not great for it for toothache. If you've lost a filling, I think that's probably one we haven't mentioned actually. If you've lost a filling, people always go, "Oh, let's put some clove oil on it." Don't do that. It's not good for the soft tissue. It's not good for the tooth either, really. Um, so if you have lost a filling, you are better to go and get one of the kits that you can get from the chemist. They come in like a putty kind of thing, and you just kind of roll a little bit up, dry the area. The drier you can get that hole in the tooth, the better it will stick in. So you put it in, follow the instructions, you put it in, kind of keep your mouth open for a couple of minutes while it harms up, and then kind of bite on it so that it matches your bite. That will tide you over until you can get to see your dentist. Many people find that when they lose a filling, the tooth doesn't hurt. Absolutely fine. But there is a hole there that food gets stuck in, or there's a sharp edge. So I would always try and put a little bit of temporary filling material in there just to stop food getting in and to ease any sharp edges as well. But not clove oil, please.
No, no. But like over the counter pain tablets, paracetamol, ibuprofen, cocodamol, these are things that I'm
Yeah,
sure we can
yeah.
all
Whatever
say.
whatever you would take for a headache or something like that is quite fine to take if you're able to do them.
Hmm.
Obviously, avoid having ibuprofen if you're not eating because it's not very good for you. Aspirin, if you are already on blood thinners, is probably not a good idea. But speak to your pharmacist. Your pharmacist will know what you can take.
Hmm.
And depending on your level of pain, they will be able to advise what is stronger that might actually help it. An anti-inflammatory is good if you've got an irritated nerve of a tooth. Um, so they might recommend that, but not everybody can take um, the sort of the anti-inflammatories
Hmm.
anyway.
Yeah, it's the
Um,
medication's always going to be different person to person, isn't it? So
Absolutely.
I think that
Yeah, but your
advice is good.
pharmacist.
If
Yeah, your
you take
pharmacist.
it for a headache, then it's
Yeah,
generally that'll be
yeah.
fine for
What you
you.
would normally take to take away pain.
Hmm.
Um, we've talked about sensitivity being generally cold. It can also be with sweet things as well.
Hmm.
It can be with hot things. Generally, if your tooth is jumping when you're having something hot, that could indicate you've got pulpitis, which
Oh.
is an inflammation of the pulp of the tooth. Now, the pulp of the tooth is where it's underneath. So you've got the enamel, you've got the dentine, then you've got your pulp, and the pulp is where the nerves of the tooth are. So pulpitis can be reversible or irreversible. If it's irreversible, it means the nerves of the tooth are going to die, and it's going to need root canal treatment. But so in certain circumstances, you can relieve it so that the nerve recovers, which again would maybe be putting like a sedative dressing into the tooth just to try and calm that pulp down,
Hmm.
and hopefully the tooth will recover. I mean, another reason for having toothache is actually an accident, like knocking your teeth, breaking your tooth. Generally happens with the front teeth, unfortunately. Playground accidents,
Hmm.
you know, running into kids running into each other or falling off their bike or whatever.
Yeah.
Um, Now, if the tooth is broken, there's not much point in looking for the broken bit because they won't reattach it. So, um, if it's big enough, they will probably fill it up with like a white filling material so it looks the same as the other one. If it has gone into the pulp of the tooth, then the tooth will probably have to be root filled because that's what's what we called an exposed nerve. So you would have to root fill that. A tooth that has a dead nerve or has been root filled often darkens in colour, but that can be rectified later on. We don't tend to do it when children are very young, but
Hmm.
once they've reached 18, we can do some tooth whitening in certain circumstances. For example, if the child is experiencing bullying or any other psychological issues because of the tooth being dark,
Yeah.
a dentist will be able to do something to improve the appearance of the tooth
Well, that's good
before
to know.
they're 18.
So, as we've been talking about all different types of tooth pain, we've fired a lot of information at you. Let's just distill it down a little bit. Let's have a chat through a real life scenario so that we can see what might come up and what Karen's advice might be to this particular person going through a particular period of tooth pain or toothache. So, oh, I need a fake name. Give me let's have a fake name. I'm looking around for inspiration. I've got nothing
We
around me
normally
that
use
doesn't help.
Jane.
So Jane has sent a question across to us, and Jane has said, I've been having a bit of on and off tooth pain for a few months now, but I keep putting off going to the dentist because I'm scared it's going to be something serious. Pain isn't constant, flares up when I eat sweet things or if I drink something cold and then it settles down again. Lately, though, it's been waking me up in the night and I've started chewing on the other side of my mouth without even realizing. I brush twice a day, but I still feel like somehow I failed at looking after my teeth. Am I overreacting or is it urgent? Do I need to get it checked out right now?
I mean, the fact that it started off gradually and it goes away after the sweet thing or the cold thing has been taken away would indicate sensitivity. The only little red flag there would be that it's waking her up at night because there's no stimuli. Unless
Hmm.
she's mouth breathing and it's really cold in the bedroom, really shouldn't be setting it off then. Um, she doesn't say whether she's tried a desensitizing toothpaste, but she could start off doing that and see what happens over the next couple of weeks. But yeah, I mean, she could try taking a painkiller if it wakes her up at night. But she could have two problems here, you see. She could be stressed because she's got the toothache, she's grinding her teeth, and that's what's hurting them,
Hmm.
or it could be something to do with the sensitivity. So it's a bit difficult um without further questioning, I think. But I would say try the desensitizing toothpaste. If the pain during the day when she has the stimuli goes away, it may relax her enough that she's not waking up at night. However, the, the after 2 weeks, the toothpaste should work within 2 weeks. So if it goes on 2 weeks and it's still like it, she needs to go to a dentist. But I'm not thinking that it's going to be anything, absolutely drastic. I think it's absolutely treatable, and I think it's not going to be too invasive, really. It shouldn't be, I
Hmm.
think, as far as I can tell. It's really difficult when you can't see somebody
Yeah.
and they're just, saying, because, normally what I would do is get them to describe the pain and, what type of pain is it? Whereabouts does it hurt? And is it just one tooth? Is it several teeth? Is it one side? It's difficult, but I would say use a desensitizing toothpaste for a couple of weeks, but be prepared to go to the dentist. But I'm not sure that she's going to need to worry. I don't think she should worry too unduly
Hmm.
because I think she might have two problems here. I think it might be grinding as well, which,
Hmm.
dentists can make a mouth guard as
Yeah.
well. So
Yeah. Well, fabulous, Jane. I hope that addresses some of your worry. Thank you. And if you want to send any questions across, we can address them at a later episode. Doesn't matter if it's one that we are talking about at the time. We can shoehorn anything in, can't we, Karen? We're good at shoehorning topics, I think.
you open me up here to very random things, don't you? It all sounds very confident, which is good.
Yeah. Yeah.
I
Roots
think
and
we
all. Well, thank you for joining us. I hope this little deep dive into tooth pain and toothaches is something that you're going to find useful. Maybe it helps address an issue that you were having, or maybe you just wanted to learn some more about it, which fair play to you. So come back next time. We're going to be talking about something slightly different. We're going to talk about what to do if you were to have one of your teeth knocked out, or avulsed is the dental word. Karen, I'm
Well
learning.
done.
It's only taken 3 years, but I know the words now. All right, and come back and join us then.